Well, thanks very much, Premier, and it is indeed very good to be here on my first visit to Victoria as the Prime Minister, but I look forward to working with you and your government for many years to come, making sure that we make a difference to people's lives, and that's what this centre will do. This centre will put patients at the core of the response to melanoma, which is known as Australia's cancer. Unfortunately, some 15,000 Australians will develop cancer from a melanoma this year. Of those, 1 in 10 will not survive. What we know is the chances of survival are improved the earlier the detection occurs. And this centre, which will have a wellness centre, will have research, will have clinical trials, is world's best practice. And it's a great tribute to the Victorian state government that this is proceeding, but also a great tribute to those who have kicked in to make sure this will happen. This is an example of federal and state collaboration, but also an example of the generosity of the benefactors, particularly Paula Fox and the Fox family, the Forrest family and others who have contributed significant donations to make sure that this vision can become a reality, with patients at the centre and making sure as well for those staff who look after people that they also are able to engage in a way in which they know that their efforts are producing the maximum results in terms of care. And that's why this is a fantastic announcement to be associated with today. Happy to take questions.
Hospital funding, one of the things that the Premier consistently talks about are aged care patients and NDIS patients who are using up hospital beds. I guess what will the federal government do to alleviate that pressure, and why is that still a concern in the state public health system? Well,
the Premier's right. One of the pressures that is on our emergency departments is people fronting up to hospitals because of other failures in the healthcare system. One of those is in aged care, that the federal government has primary responsibility for. That's one of the reasons why our 5-point plan for aged care had 24/7 nurses at the front of it. If you are an elderly resident of an aged care facility and you have a health issue but there's no nurse or health professional on site, often you'll be put in an ambulance and taken to an emergency department at great cost to the healthcare system than if there was someone on site who may well be able to take what is a small or medium health issue, not an acute healthcare issue, and deal with it on site in real time. It's one of the issues that we need to examine in terms of the healthcare system. Similarly, a lot of people in terms of with disabilities find themselves in hospital because they haven't got the care that they need, either in their home or through an appropriate service. It's one of the reasons why as well we will have 50 urgent care clinics dealing with immediate issues, so that if you're at a sporting event and your son or daughter falls over, breaks an arm, you can go somewhere, get that care immediately with your Medicare card and take pressure off emergency departments. The really constructive discussion that we had on Thursday night and Friday morning was at our common position, which is that we need to deal with federal-state relations, not in a way that seeks to pass the buck from one section or the other, but how can it work more efficiently with patients at the centre? How can we achieve better outcomes? We will have another discussion in a few months' time about how we do that. For many of these issues, the solutions are obvious, and that's why Premier Andrews has identified, for example, aged care, but he's not the first person to do so, with respect. It's been known for some period of time, and yet when we raised 24/7 nurses in my budget reply, all we got from the former government was that it's all too hard. Well, it's too important to ignore, and my government won't ignore it. Doesn't mean we can solve all the problems overnight, but we can work constructively. and that's what I will do with every Premier and Chief Minister.